People go for snoring, but they need to figure out if they're treating snoring, if they're treating a real medical problem, like sleep apnea, so that they treat the cause of their snoring instead of the noise.
Dr. Ludwick's in-house state-of-the-art sleep lab allows him the opportunity to evaluate his patients in a comfortable setting.
Well, people don't come see me for a test, okay? They come see me because they feel a certain way, and they don't want to feel that way anymore, or they don't want to have this symptom like snoring anymore. Testing is a means to an end. It's a means to understand what is going on with you so that I know how to treat you, okay? So we have to have the test to know if I'm treating someone who just makes a noise or someone who actually has a medical condition that causes heart attacks and strokes, and as you saw in the nightly news, if you watch the nightly news, increased chance of cancer now. So it's a real medical problem. So I do the testing. The testing is necessary for the treatment, okay? Once we decide that you need treatment, let's say for sleep apnea, then we got to figure out how we're going to treat you. There's lots of different treatment options. There's surgical ways to treat sleep apnea. There's non-surgical ways, and it just depends on the person, their anatomy, and their overall health status. Which way that we want to help them. And the good thing about coming to an ENT that does sleep is that sleep apnea is an upper airway problem. It's not a lung problem. Okay, you don't have a lung problem. You have a can't get the air to your lung problem. Yeah, and so that's why it's good to go to an ENT, because then we can address all the anatomic issues you may be having, because these guys have other things like deviated septums or big turbinates or big tonsils or huge palates, big tongues, things that we can help surgically manipulate those structures so that they're not causing obstruction, or if they are causing obstruction, cause less obstruction. And that's the benefit. And also use these other non-surgical techniques like CPAP or oral appliances or things like that.
From initial testing and evaluation to a successful treatment plan, Dr. Ludwick provides his patients with a one-stop solution.
That's the purpose of us building a relationship. It's not something we fix in one visit, it's a journey, and we're gonna evaluate you, find out what the problem is, pick some options, and let's see how you do, and then we can always change the plan. It's not written in stone.